Sometimes the patients have a very rapid change in prescription and become very myopic really quickly or more nearsighted very quickly. That can indicate a blood sugar shift. So sometimes we'll catch diabetes because patients come in and they say, wow, I really can't see over the last week. And so we'll send it back to their primary care for blood work, and sure enough, their blood sugar has shifted. So sometimes it's not looking in the eyes, it's just actually doing a prescription check.
Welcome to the Erie Wellness Podcast, your go-to source for all things health, wellness, and living your best life right here in Erie. I'm your host, Lauren Brunetti, and I'm so excited to have you here. Each episode will dive into conversations with local experts and wellness professionals who are making an impact in the world of health and well-being. Before we jump in, be sure to like, share, and comment on this episode. We love hearing from you and seeing our community grow. Now let's get started. Welcome. Today on the Erie Wellness Podcast, I'm joined by Dr. Kennedy, a Colorado native and trusted optometrist. He's the founder of Summit Vision Care here in Erie and recently expanded his practice to a beautiful new location on Mitchell Way. From innovative dry eye treatments to myopia management in kids, Dr. Kennedy brings decades of expertise and a passion for personalized care. In today's digital world where screen time is higher than ever, I'm excited to learn more from him about what we can be doing to better support our eye health at every age. His office is always wonderful to work with, and that often starts at the top with leadership and doctors who truly care. So let's dive into today's discussion. Welcome, Dr. Kennedy.
Thank you very much for having me. I appreciate it. I'm excited to do this. You've been doing a great job with spreading wellness around Erie, so I'm happy to be part of it.
Well, welcome, Dr. Kennedy. I'm excited to learn and hear from you a little bit. It's funny because I actually wanted to be an optometrist
Cool.
as I was ending high school and going into college. So I went to CU Boulder as well. And as I was kind of finishing up things there, I started taking some of the pre-med classes, and we even went out to Pacific University
Great.
to tour because I knew that at the time, I don't know if it's still true, but Colorado residents got in-state tuition. So I don't know if that's still similar, but at the time when I was looking around at programs and things like that, that was the case. But it's funny because I got to tour the campus and everything like that at Pacific.
It's beautiful up there. Yeah, there's still a program where you get a discount on tuition if you go up there from Colorado, because there is no optometry school in Colorado. So it was great to go up to Oregon. I loved it up there.
And you said your daughter is attending or going to be attending?
My daughter, so she did not want to attend the rain in Oregon. She was like, Dad, I want to do optometry school, but I'm not going there. So she is at Southern California College of Optometry in Fullerton, California. She is just finished her second year. So she's just starting to see patients. So it's great to talk with her and be able to, communicate with her all about eyes. It's really fun.
So, Dr. Kennedy, can you start by telling us a little bit about your journey into optometry and what inspired you to open your practice here in Erie?
Yeah, it was actually at CU. I took a psych class, which was one of my, just a general psych class. They had a lecture on eyes and vision and perception and anatomy, physiology of the eye. And I just thought it was fascinating. I thought it was really cool how the eye worked. And I'm kind of a biology geek. I like all things biology and science. So the eye was just fascinating. And I kind of thought I wanted to be in healthcare, and just those two come together. It was just like, this is going to be a good fit. So decided to, in probably sophomore year in college, I was like, yep, I'm going to do optometry. So started applying to the schools and went to Oregon, up at Pacific, enjoyed my time there. And so really just loved the idea of, being able to help people and go into healthcare. And so optometry was a great fit. So I really enjoyed my time there. And when I came back from Pacific, I ended up working essentially at a school, worked for an ophthalmologist in Boulder for quite a few years. Learned a lot about ocular disease. I did a lot of the contact lens fittings. And so I learned quite a bit there. And I think just over time, I decided I kind of want to do my own thing. When I looked for opening a practice, Erie was there was no optometrist here at the time. It was going to be a growing community, which clearly after 15 years now, it's been crazy. So opened up in 2010, and I've got two great associates, very intelligent, kind associates who work with us now. And so we've got a really good team, and it's been great to grow with this community. I wanted a community that I could kind of really grow with, and that has really come to fruition. It's been really great. The community has really supported us.
That's awesome. Well, you did choose a town that, you kind of started at the forefront, because when did you start practicing here in Erie?
Yeah, 2010, and it was just kind of about to really take off. Really, there was not much here at the time.
And one thing that I love about eye health, and maybe why I kind of was attracted to it, was you can tell so much about a person's health by like what's inside their eyes. I feel like we talked a lot about even diabetes. Sometimes you guys can almost bring up some preventative stuff by what you're seeing inside someone's eyes.
Yeah, that's correct. I'll find high cholesterol in patients. We find, diabetes, hypertension. I have patients that, unfortunately get hemorrhages in their eye because they weren't taking their blood pressure medication. But we can usually, try and stop that. If you come in for a routine exam, we can look back there in the back of the eye and find something, send them to the primary care doctor and get that taken care of. So yeah, we can see a lot about their overall health back there for sure.
So how does our overall health, especially nutrition and lifestyle, impact our eyes and help prevent conditions like macular degeneration and other ocular diseases? Are there any specific dietary changes that you might recommend with your patients?
Yeah, the big one you mentioned, macular degeneration, that is a big one, but a lot of it is kind of our eye health will follow sort of, what we eat and how we take care of our bodies. And so the big one is macular degeneration. The macula is the central part of the retina, so to the back of the eye. The retina is the tissue that captures the image. What we see in the center part of that is the macula. And so if you lose your macula, it's very debilitating because you can't see centrally. Sometimes patients lose their ability to drive or see clearly. And so the macula is very important. And unfortunately, with macular degeneration, there are medications and injections that can manage it, but really not cure it. So prevention is really the key, starting from a young age. Risk factors for macular degeneration are age and genetics, but really diet plays a role. So even the retinal specialists today, when I go to lectures, still talk about lifestyle choices, and it's still really important. So one of the big thing is smoking. Avoid smoking. You're probably 2 to 4 times more likely to get macular degeneration if you smoke. So, that messes up the rest of our body. So definitely don't want to smoke. Certain nutrients are really important. So the studies that were done on macular degeneration, vitamin C, vitamin E, zinc, and the 2 big ones are called carotenoids, and the lutein and zeaxanthin. So lutein and zeaxanthin are really they're found in the macula. They're also found in green leafy vegetables. So I know kale is not everybody's favorite, but if you can do spinach and kale, really helpful for your vision. And some people can't take spinach and kale or eat that because they're on other blood thinners or whatever. So you can take a lutein or zeaxanthin supplement, from over the counter. So that's certainly something you can do. But those are big ones. The other thing, linked to cardiovascular disease. So macular degeneration is associated with hypertension, diabetes, cholesterol. So again, kind of just watching your cardio health with your primary care doctor. Everything I think with disease in general is inflammatory. So eating things that are saturated fats, refined sugars are inflammatory. So the eye is pretty sensitive to nutrition, oxygen changes, and inflammation. So if you can reduce inflammatory foods in your diet, that's helpful as well. Some debate about omega-3s. I think there's that soon to become, some studies about omega-3s. They may say that that's really not related, but omega-3s may help the eyes in terms of the macula. So, and wearing sunglasses can help too. But yeah, just basically do what a nutritionist would tell you to do. Very helpful.
That's all really good information. We don't often think about how what we're eating and we're consuming, like it impacts our physical body. And I think a lot of us are just worried about that, but our eyes impact our daily life so much. So taking that into consideration as well. And you can throw like kale and spinach into smoothies and just do little things, or be conscious of like what are like the little supplements that you might be able to add.
That's correct. Yeah, correct. Yeah, you can mask it. Yeah, correct.
So another thing that I wanted to talk too about was, so how do hydration and screen time impact our eye health, and what steps can we take to protect our vision in today's digital world?
Yeah, so hydration is interesting. I have a lot of patients that will say, well, I'm really hydrated. My eyes feel a lot better and they feel less dry. I have some patients that don't notice the difference. And there are some studies showing there's really not a correlation with hydration. Dry eye comes from a whole bunch of other issues with the lid, but so that depends on the patient, I think, for sure. The digital stuff, we are kind of a world of screens, and that is the reality, unfortunately. I know the schools hand out tablets. If I had my way, they wouldn't do that because kids on screens can be a little bit rough. So the main thing with screens is we blink about 66% less when we're on a digital device. So they're on a computer or whatever. So what happens is most people complain of dry eye. That's one of the things that we get. And so there are glands in the lid called meibomian glands, and those glands and the whole tear system, when you blink, they refresh the tears. And when you're not blinking, you're not refreshing those tears, and the whole system is not working. So dry eye is a big complaint with computer use. Just in general, kind of eye strain, headaches that can go along with computer use. Kids, when they're on screens, are more likely to become myopic or nearsighted. So myopia means you can't see far away. And so that's been a big thing with children, is more kids are becoming more nearsighted. And certainly since COVID, there's been an increase in nearsightedness. So nearsightedness doesn't just mean, you're wearing, you have to wear glasses, but long-term, very high nearsightedness can cause problems with the retina, retinal detachments and tears and things like that. So we really want to try and reduce nearsightedness as much as we possibly can. And we do myopia management in our office. But kids who play outdoors more often, at least 2 hours a day, which in the wintertime is more difficult, but kids who play outdoors more are found to be less nearsighted. So that's been beneficial. So yeah, screens are a challenge. Some people ask about blue light and, can reducing blue light help me? And there's some debate in the science world about whether that's really true or not. Mm-hmm. I have some patients that will reduce the blue light on their monitors or their devices and can really sense a difference. They really think, wow, this is great. Or they wear the yellow glasses that can help with blue light, and they really find a difference. And I have some patients that don't really notice much of a difference with that. So that can vary depending on the patient as well. But blue light is thought to mess with our circadian rhythms, also tend to cause headaches and eye strain. So again, if it's an issue with you to tone down the blue light on your monitor, try some blue light glasses. It can help, not for every patient though. We'd recommend trying, if you're on a monitor all day, try the 20-20-20 rule. So every 20 minutes, look 20 feet away for 20 seconds. It doesn't have to be exactly like that, but the concept is don't stare at your monitor 8 hours a day. Get up, move around, look around. That can reduce computer vision syndrome or digital eye strain as well. So those are really the keys, is really take breaks, reduce the blue light, and try and stay off screens as much as you can.
Mm-hmm. Did you say it was our eyes blink 60? Was it 66 or 60%?
Or less, yeah.
Wow.
When you're staring at your computer, that's a lot. And so that, it's a lot. So that's why you got to take breaks in, artificial tears at the computer, whatever you can do to kind of just, take breaks, replenish those tears. Yeah, it's significant.
And one of my questions as you were talking was, are we seeing more kids in the eye doctor because of some of the screen time and things like that? So
myopia is one of the biggest concerns. Yeah, I'm sorry. Myopia is one of the biggest concerns, is that kids are becoming more nearsighted and their glasses prescription keeps getting worse and worse. And again, there are ways we can slow that down, but that is a thing. I was at a dry eye conference where one of the doctors that specializes in dry eye was talking about how, again, those glands in the lid, they atrophy as we age, but they're seeing atrophy even in young kids because of so much screen time and staring at digital devices. So it's not just nearsightedness or myopia, it's also now about dry eyes, and the function of our glands and our lids they're being affected as well. So
what are some of the symptoms that kids are coming in with and saying that, I'm having trouble with?
I mean, for dry eye, it's typically my eyes burn. One of the symptoms of dryness is burning, feeling gritty. They can feel dry. Other symptoms of dry eye, I get fluctuating vision when I blink, things like that. So, and not all kids are doing that, but it's becoming more common. Dryness is more common in adults.
So interesting. So dry eye, it seems to be common, especially here in Colorado because of our dry climate. So what causes it, and what does a dry eye care routine look like for maybe adults or children, or both?
Yeah, it is very common. And even what's interesting too is, even though we're in Colorado, we get a lot of dryness, even in a place like Seattle, because the issue a lot is with the glands and the lids. A lot of it, dry can be anywhere. The main thing with dry eye, about probably 30% of the population seems to have dry eye. I think that those are the stats, but I think it's probably more. I seem to get everybody complaining about dry eye here in Colorado, like you said. The main causes, a lot of it can be computer use. You can have medications that cause dry eye. Age and hormones are a factor. Contact lens wear is a factor. Autoimmune disorders are a factor. So it really is multifactorial for a lot of patients. And some people unfortunately have, a lot of these things. And so trying to come up with dietary things and treatments are really key. And the good news now is we have a lot of treatments for dry eye. Back 20 years ago, it was just here, try some artificial tears, but there are a lot of treatments now that are really beneficial. So one of the things, again, I talked a little bit about the glands. There are glands in the lower lid and upper lid called meibomian glands, and these glands secrete oils for the tear film. If those glands don't secrete the oils properly, then the top layer of the tear film is not there and the watery layer just evaporates, it just dries out. So really getting those glands to function is really key. So kind of on a first start basis, we have people do artificial tears, and there are some brands that have some oils in them and things like that that can help with those glands. And really a hot compress is one of the keys. So heating up those glands, and we recommend a heat mask or a dry eye mask. You can get those online or anywhere. They put them in the microwave for like 20, 30 seconds, put them on your eye for 10 minutes, and it helps those glands open up and it really gets those glands working. So that can be helpful. And we'll recommend typically an omega-3 or fish oil. So when you take fish oil internally, it helps to change the consistency of those oils in the glands and can make you feel better. So those things can take about a month to kind of kick in. And then if that doesn't work, we have other treatments. But that's kind of the first step, is really to do that. Now there are also, if that doesn't work, there are little tear duct plugs we can put in the tear ducts that can keep the moisture on the eyes. That's an in-office procedure that we do commonly. It can really help patients. Immediate volume of tears. The other thing, there are some prescription medications that take a few months to kick in, but can really help people, especially with autoimmune conditions. They're kind of have a basis that they're anti-inflammatory, and they can really help as well. There's actually a nasal spray now. You spray in your nose, it stimulates a nerve to start the lacrimal gland cranking on the tears. So there's a nasal spray now that can work. We also offer one of the major treatments out there is called IPL, or intense pulse light. And IPL came out of aesthetics, and people were doing this for cosmetic reasons, for blemishes and blood vessels, things like that. And people were like, hey, my dry eye is better. What's going on with this? And so all these studies later, these companies have these devices out that really target dry eye. So it's a light that we run across the cheek and right at the lower eyelid, and it basically reduces the inflammation around those meibomian glands. So it targets the tiny little blood vessels that cause the inflammation and damage. And those meibomian glands atrophy over time. Unfortunately, they don't come back. And so one of the only ways to truly get to the target of the meibomian glands and reduce the inflammation is doing an IPL. And it's a thing where we do about 4 sessions, 2 to 4 weeks apart. Most people notice an improvement about 3 to 4 sessions. And then sometimes an annual maintenance session is needed as well, but it can really target the inflammation of those glands and can really get patients some relief from dry eye.
What does it feel like when the laser's going?
So it's actually technically not a laser. It's just an intense pulse light. There are some people, I've had it done, and some people, I was actually expecting some pain, and it's really not painful at all. It feels like a little warm zap of light, honestly. Most patients don't complain of pain at all. It's kind of warm, fairly therapeutic. Sometimes they'll be a little zappy if you run across some pigment, but it really isn't uncomfortable for most patients. So yeah, it's a little zappy, a little hot, a little warm.
Does dry eye, so the symptoms, does it sometimes increase when you're experiencing allergies and things like that as well?
Yes. Allergies and dryness go hand in hand. So if you have allergens in your eyes, certainly that makes things uncomfortable. And dryness symptoms, again, can be grittiness, can be itching, can be burning. So there are some really good over-the-counter products too that work for allergies as well that can both of them. But yes, allergy, dryness go hand in hand.
Okay, good to know. Okay, so let's move on to our next topic, and that's losing, our reading vision. For individuals, it kind of usually starts in your 40s or a little bit older, but you lose your reading vision, also called presbyopia. Did I say that correct?
Yeah.
Okay, so that's very common, but it can be frustrating for adults because, when you start to see vision changes. But what's the best ways to manage this?
Yeah, so presbyopia essentially is the hardening of the lens in the eye. So the lens is very elastic when you're younger, and you can look far away and up close and without any problems. As we hit our 40s, that lens loses that elasticity. And so you lose your reading vision. So people ought to go into bifocals or whatever. So yeah, everybody gets that pretty much. I mean, I have a few people in their 50s that don't need readers. I don't know what their genetics are, but that doesn't happen very often. So a lot of people who don't wear glasses can just pick up some over-the-counter reading glasses and put those on. Those tend to work fine. For people who are in glasses already, you can do a progressive or multifocal lens, and the designs on those lenses have gotten really quite good, to the point where there's very little distortion. People adapt to them quite easily. You hear more stories about progressive lenses, but really people do very well with them. And that allows you to see far away and up close, so that can work. For contact lens wearers, there are a couple of things. People can use readers over their contact lenses. Some people will do what's called monovision, where there's one eye that's set for distance, one eye that's set for up close. It sounds kind of strange, but there are a lot of people who adapt to that very well, and it works quite well. There are multifocal contact lenses where there are different zones in the lens and you can see far away and up close. So those can work. The other thing is there are some eye drops out now too. They're not used commonly, but there are eye drops that you can put in, and essentially the way they work is they constrict your pupils to get this really great depth of focus. And it gives you maybe a few hours of reading vision. So it's not a cure or permanent, treatment, but and they do come with some side effects. But for some patients, they can be an option if you're, going out and you don't want to, carry your readers around. You just want to be able to go out and see the menu or whatever. You can try these drops, and they can help, temporarily. So it's pretty interesting.
It's so fascinating how our cells just naturally start to age, and we see it in different parts of our body, like start to see gray hair. It's like we're not getting as much pigmentation, and it's just amazing how it just shows up in different parts of our body.
It's just kind of part of the deal. It just happens. Yep.
But it's great to know that there's things we can be doing daily, just in putting in those lifestyle habits. But then it is nice to know that there's modern medicine that can kind of help us so that we're not dealing with and struggling with this further.
Yeah, the technology for certainly dry and in multifocal contact lenses, the technology has gotten great. We have so many options now.
Have you seen, just being in this space for as long as you have, like what has happened over the period of time that you've been in the optometry space?
Oh, geez. In terms of, it used to be, the choices in contact lenses were few and far between, and the optics were sort of not great. So now we really have a lot of choices with just much, the optics are much improved. Multifocal lenses have gotten better. We have so many choices now. A lot of the lenses come in daily, so you can do daily multifocal lenses. There are lenses that correct for astigmatism and multifocal at the same time. So yeah, the choices are just really, I won't say endless, but there are a lot of choices we didn't have, 20, 30 years ago.
So some of the terminologies I just don't know about. So I don't wear glasses. I feel very blessed. But what are multifocal contacts, and how do multifocal contacts compare to reading glasses?
Yeah, so multifocal contact lenses are designed, so there are different zones in the contact lens. So a lot of times there'll be a contact lens that has a center zone that's for distance, and then the peripheral part is for near, and it can vary depending on the brand and the type. And so people ask, well, if I put these multifocal lenses in, do I have to worry about where my head is? And no, it's not like that. You just kind of put them in and go. And so the challenge with multifocal lenses is trying to find a compromise where we can improve the distance and the near vision without having, with both being clear. Sometimes the multifocal lenses, when we put them in, can affect the distance vision a little bit. So there are some compromises, but again, the technology has gotten so good that most people don't have to sacrifice much vision. But they're typically different zones in the different lenses. And I have some patients that do very well with them and do fine. And some patients, we try multiple lenses and we just can't find something that works. So how do they compare to readers? It depends on the patient. Some people will kind of give up on multifocal lenses and just stick with readers. Readers can provide a little bit crisper vision, but the downside is you're then constantly having to find your readers every time you want to read something. So the multifocal lenses can get people out of that need for readers.
Is there any correlation between like what your parents' eye health was and what they were dealing with and what you're going to experience?
Yeah, so not in terms of presbyopia, because everybody gets that. That's just kind of an aging thing. In terms of myopia, if you have two parents that are myopic, 50% chance that your kids are going to be myopic. And if you have one parent who's myopic or nearsighted, then about a 25% chance. So that's in terms of the prescription. And there, sometimes astigmatism where the cornea is a little bit out of round, that can run in families. The other big ones are like glaucoma is a big there's a big genetic component with glaucoma. That's where your eye pressure goes up and you start losing peripheral vision. So that's a disease of the optic nerve. And there's a genetic component to that, and as well as macular degeneration. So some of those are inherited, but in terms of eyesight, it really can run the gamut.
Okay. So you've mentioned that there's a link between vision and hearing loss and the risk of dementia. Can you unpack that a little bit for us?
Yeah, so this is kind of new research that's come out, but I've seen it in multiple places. And so, certainly it piques our interest when we hear, a loss of vision can impact, your dementia or Alzheimer's. So that's basically the research, is that if you have hearing loss and vision loss, it greatly increases your risk of dementia and Alzheimer's. As I understand it, there's something called cognitive load, which is if you're trying to do a task or learn a new task and you don't have the input from your senses, hearing and vision, that kind of challenges the brain, and can lead to dementia. Again, some of the studies are kind of new on this. They're still kind of working on that. So also, if you are, hearing impaired or vision impaired, you're losing some of that. What happens is you tend to not be as social. And so reduced social interaction can also play a role in leading to dementia too. So it's sort of multifactorial. And so in our realm, we basically, a lot of my conversations are with cataract patients. So patients who have cataracts will recommend, maybe doing this a little bit sooner than you would have normally. So back in the day, cataract surgery was something where you just had to wait until they got really bad. And that's clearly not the case anymore. The technology with cataract surgery is amazing.
Mm-hmm.
It's super easy 8-minute surgery. So we generally tell patients, if there's one other reason to get cataract surgery sooner, it's because of this risk of dementia. And so you don't want to wait, and don't want to lose vision. You want to get this stuff done and take care of it.
It's kind of like the saying, if you don't use it, you lose it. So
it's in some way you're not using those neurons, and it's affecting how that affects your brain long term. So yeah, exactly.
Mm-hmm. That's really interesting. And some things to definitely think about. You don't want to keep putting stress and hitting that load. You're just going to max out. And I feel like you hear people saying that they're doing their Sudoku puzzles and things like that to help offset some of those mental decline diseases and things like that. But it's also interesting to hear that, vision and hearing loss can also impact that as well.
Yeah, there's a new frame line out too that it's kind of interesting. You can put prescription in it, but it also captures sort of sound from where you're looking.
Mm-hmm.
And in the temples, there are speakers in the temples that basically enhance that sound. So people that either don't want to wear hearing aids, or maybe aren't quite ready for hearing aids, this is kind of another step where you can wear these glasses out and about, and you can actually use them to enhance the sound. And so you're not out to dinner and having a hard time hearing. You can actually focus on the patient or the person who's talking to you, and you can have that sound enhanced. So it's pretty interesting. There's a lot of technology coming out that can really help us in both of those realms.
Well, I know of a couple of family members who kind of didn't want to, especially put in hearing aids or things like that. But now knowing that kind of research, it's encouraging them to, you don't know what something could happen if you don't. So might as well.
Yeah, right. It can be frustrating with hearing aids and glasses because you have to adjust the glasses around the hearing aids. And it's a challenge. So yeah, so there's some new products out that may be able to help that.
Cool. So how often do you detect signs of systematic health issues like high blood pressure or diabetes during a routine eye exam?
Yeah, I would say almost every day I find something. We can detect high cholesterol, we can detect hypertension, diabetes. So a lot of the cardiovascular diseases we can see in the retina. The retina in the back of the eye is the only place really that you can actually actively see blood vessels in sort of their natural state. And so we can, if the blood vessels look a little funny, it can indicate hypertension. There are indications of high cholesterol. So the conversation generally is, if you haven't had a physical in a while, go back and, to your primary care doctor and get a physical. And some people have, some people it's been 5 or 10 years. And so there's just that conversation of, keeping your overall body healthy. Sometimes the patients have a very rapid change in prescription and become very myopic really quickly, or more nearsighted very quickly. That can indicate a blood sugar shift. So sometimes we'll catch diabetes because patients come in and they say, wow, I really can't see over the last week. And so we'll send it back to their primary care for blood work, and sure enough, their blood sugar has shifted. So sometimes it's not looking in the eyes, it's just actually doing a prescription check. So that can happen as well. We see, things like autoimmune disease. Sometimes people will come in with a red eye, and it's not just pink eye. Sometimes red eyes are inflammatory, or something called iritis or uveitis. And so we find that, and sometimes that can lead us to a diagnosis of lupus rheumatoid arthritis, things like that. So we'll find autoimmune issues with the eye. Unfortunately, there are times when people have some vision that seems a little bit strange, and they're losing parts of their peripheral vision, and those can end up being brain tumors. So we catch those on occasion too, not commonly, fortunately. One of the other things we see in the eye is multiple sclerosis. So we'll catch MS. It can affect the optic nerve and color vision. So sometimes people will come in with some strange symptoms. Again, we'll run some tests and then send them on to a neurologist or the primary care doc, and that can be a link to MS, unfortunately, too. So there's a lot in the eyes that we can find that really, and we deal with a lot with endocrinologists, primary care doctors, and neurologists. So. And
long story short, do your routine exams that you need to do. Don't ignore symptoms.
Right.
So that's all really encouraging. Just you saying all of that.
So. I have a lot of patients that, I see 20/20. I don't need an eye exam. Well, yes, I mean, I understand you see 20/20, but I can't, you don't know what's going on in the back of your eye. There could be tumors back there. There could be retinal tears. There could be a lot of things in the back of the eye that you can't see. And glaucoma is one of those we call the silent eye disease. You can't feel if your eye pressure goes up, and you can't spot the early signs of peripheral vision loss. And so, a routine eye exam, having your eyes dilated or using the Optometrist retinal scan is very important every year.
Mm-hmm. If you do have good vision, like as you age, is it helpful to still put on either readers or things like that so you're not straining your eyes as much as, your cells are starting to get a little bit older? Or is it really not until you see vision changes that you need those for
the reading thing, you don't need to nothing will kind of prevent that. So, and there are a lot of people think, well, I don't need to wear my readers, I'm trying to work my eyes. And that can be, but that lens is going to harden over time anyway. So in general, no, as long as you don't need glasses, I mean, you don't have to put on any extra correction for that. Again, the blue light glasses, if it really helps you with the computer, but again, that's more of a personal preference.
Right. Well, Dr. Kennedy, I'm really enjoying our conversation. What would you say are some of the top things we can do to protect our vision as we age?
Yeah. So one thing, again, we just talked about yearly eye exams, especially over the age of 40. Kids who have healthy eyes, maybe every 2 to 3 years, but over the age of 40, certainly a dilated eye exam every year, or an Optometrist retinal scan. We have an Optometrist, which is nice. You don't have to have your eyes dilated. We can take images year after year and kind of look and see what those images look like and compare them. So that's really nice. But yeah, definitely get an eye exam every year over 40. Avoid smoking. Smoking is not great for your eyes, and obviously not great for the rest of your body, but that can cause damage to the eyes. I also tell people, don't sleep in the contact lenses. If contact lenses they shouldn't be slept in, and so you can get corneal ulcers that can cause scarring, essentially sometimes leading to permanent damage. So don't sleep in contact lenses. That's the other way to keep your eyes healthy. Follow a good contact lens care routine. Another thing you can do is wear safety glasses. We see injuries from pickleball and people using power tools that should have been wearing safety glasses. So that's another thing to do. In general, I would say the best thing is do what a nutritionist would tell you to do. If you can eat healthy, get a good colorful diet, make sure that you're exercising, watch your cardiovascular system. All of that can lead to good eye health. So basically, do what a nutritionist would tell you to do.
Great advice. And how can Erie residents get in touch with your office or learn more about the services that you provide?
Yeah, so you can go to summitvisioncare.com. We have a scheduling link on there now. If you want to schedule, they can certainly schedule. Most of our information is on there. And we also are on Instagram and Facebook as well.
And you see adults, children, full scope of patients.
Yeah, we see kind of, we see all ages. We do pretty much everything but surgery. So we can treat eye disease. We do ocular emergencies. We have an optical. People can come browse in their optical whenever they want. So we kind of are full eye care providers. So unless it involves surgery, we're pretty much taking care of it. We remove foreign bodies. We treat dry eye. So pretty much everything. We see kids, fit all types of contact lenses. One of my areas of expertise is specialty contact lenses. So anybody with kind of unique, corneas or complex challenges, I fit those. So it's really a lot of fun.
And in terms of kids, when do you want kids to starting those routine eye?
Yeah, I know my sister's gonna have another podcast on that, but generally we do infant exams. And so there's a program called Infancy where we will do a free eye exam on any infant under the age of 12 months. And it's just a great way to establish, binocular vision. Does an infant have eyes that are teaming up? Do they have a prescription? We can find prescriptions in infants. It's amazing what we can do with technology. And Dr. Rohr's great at that. Actually, she's most of our pediatric patients. But generally, it's infant exams about age 3 and then about age 5 or 6 when they start school. Those are kind of the guidelines. And
you accept a wide range of insurance, but in case you don't have eye insurance, do you give discounts?
We do. Yeah, we do self-pay. We take most of the major vision plans, and for medical emergencies like pink eye and things like that, we use your medical insurance. But yeah, we do give a cash pay discount for patients who don't have insurance, correct?
Okay, great. Well, Dr. Kennedy, thank you for sharing your time and insight with us today. And if you're local and looking for a trusted eye care provider, Summit Vision Care is a great place to start. Their team is consistently warm, professional, and patient-focused, which reflects the heart of their leadership. You can visit them at their beautiful new location in Mitchell Way in Erie. And thanks for listening to the Erie Wellness Podcast.
That's a wrap for today's episode. Thank you so much for listening to the Erie Wellness Podcast. I truly appreciate you being a part of this journey. If you loved today's conversation, don't forget to subscribe, leave a review, and share it with a friend. For more daily wellness inspiration and behind the scenes content, be sure to follow me on Instagram at the Erie Wellness Podcast. I can't wait to connect with you again soon.